you know.
Just a moment. That's see waiting room. What does it say? Okay, admit. Okay, okay. Let's.
Resume share. Resume share. Pause ಮಾಡಿದ್ವಿ.
Okay, I'm recording the program now.
Yes.
They will work on it. Okay, if I get a signal, I'll just go ahead and admit. So.
Yes, I will invite everyone, and then we can start. I will hand it over to you, so you can start.
Just one second. I'm still have to read the issue. Can you hear me? Can you hear me good?
Yes, we can hear you, and I'm sure all of my participants can hear you as well. So here is me. Okay. I'm Lata.
Okay, I'm having a little bit of a interference. Okay, it's okay now.
It's echoing?
Not echo. It's okay. It's just coming back. Okay, whoever. So.
So it's 5:01. We start now. So we're all ready, right?
Okay. I mean, you tell me. Yeah, you go ahead. Time is, yeah, it's your 5:01.
We can start now.
Okay. And I will keep on admitting. Don't worry about admitting. You go ahead and start.
Sure.
I'll take care of it, and I'm also recording the program.
Perfect. So hello everyone. Welcome to Yoga for Each One Awareness Week. This is 16th week talking about yoga therapy for cardiovascular disease. And this whole month we are talking about health of our heart. And today we have Dr. Sarkar with us. I'm honored and delighted to introduce Dr. Sarkar. So Dr. Sarkar will be speaking to us about yoga therapy for cardiovascular diseases. Dr. Sarkar is a retired vascular surgeon, among other things. He's an author, yoga therapy. No, he's an author for yoga therapy, Ayurveda, and Western medicine. I have this book here. I encourage everyone to take it and read it. And he's a former associate professor of surgery and avid researcher who has published many papers on Western medicine as well as yoga. And he's a yoga certified yoga therapist and Ayurvedic practitioner. Dr. Sarkar has over 50 years of experience with Western medicine, which he is now using to bridge the gap between yogic wisdom and Western medicine. And Dr. Sarkar currently serves as a chief of integrative medicine and yoga and has served on the board of directors of many medical and yoga organizations. Lastly, he has won many awards. And for his service, the highest award is Yoga Acharya, and that is the highest award for his service and knowledge in the field of yoga therapy. Welcome, Dr. Sarkar, to kind of this program, and please educate us about how to go for our heart. This whole month, we talked about heart, and we realized heart is our identity, like I mentioned it to you. So first heartbeat is the sign of life, and the last heartbeat is the start, death, we say, is the end of life. So that's why we need to pay more attention to our heart because it's our identity. Then the second one, we talked about philosophy of heart. So it will not only work for you, that means take care of your body, it feels for others. If somebody is getting hurt around you, you feel for them. Your heart is beating not only for you, but for others as well. And there is a heart culture. So culture of the heart is it never stops beating. That's one thing we need to understand. It will adjust itself to your needs. If you're running, it will speed up so that you will get energy. So it will start pumping fast. So you will get energy to finish your work. And when you're resting, it will calm down so that it can rejuvenate all other part of our body. It adjusts itself. That is the culture. We need to kind of adapt. And our heart is working for us. And now it's time that we need to work for our heart. Without heart, we cannot survive. That one thing is for sure. With that knowledge, with that note, I welcome Dr. Sarkar to enlighten us about how to care for heart and how what Western medicine says and how we can bring ancient wisdom to work, make work for us. So welcome, Dr. Dr. Sarkar. Please take over, and then here is the thing. So you can start showing. And before we start, I would like to kind of show just one simple note. Okay. So this will, we will be doing yoga practice here. So we always tell you to listen to your body. Your body is your teacher. If you are pulling or pushing too much, it will send a signal, which is called pain. So you have to stop right there and listen to your body. So if just an instructor, we will be telling you what to do and how to do. Then the second thing is this video and this whole program is for educational and instructional purpose only. And if you have any medical issues, medical conditions, please seek doctor's advice. So today we have doctor with us. You can kind of ask him also. And yoga for each one and its educators will not be liable for any injury during and after the session. So we'll be taking pictures to post it on Facebook. So by stepping to participate, you are acknowledging these rules. So with that note, Dr. Sarkar, it's all yours, and I encourage you to kind of take over.
Let me see if we can unshare this so I can see mine.
Yes.
You need to unshare, or let me see if I can get a spotlight video. Okay. This will work. Okay, good afternoon. All of you can hear me well?
Yes.
Hopefully?
Yes.
Okay. So today's topic that I was saying that yoga therapy for cardiovascular disorders. The first, I see many of you here. It looks like you're a yoga teacher, yoga therapy teacher, long-term yoga practitioners. I see a few of my friends. I see their names also. The first, you need to understand the cause of the heart disease, cause of the cardiovascular disease. You understand the concept, on what concept you are based on the yoga therapy. So what happens that most of you have a practice. Most of you have a practice, and once you understand the reason why you are going to do it, you will be pick and choose the asanas, pranayamas, meditation, the body type, we call it vata, pitta, and kapha, and you will be able to guide your own practice and also during your teaching. So let me first start with that we teach, very sort of a scientific way that for healthcare provider, that what is yoga, a definition of yoga. It's a very absolutely important because in West, it has totally diluted into the asana practice. And for us as a yoga therapist, it is a total holistic. It is not reductionist. So yoga as a definition from our yoga therapy perspective is that it's a philosophy. It's a Yoga Sutra of Patanjali, 196 sutras, of which 193 are to control your mind. Chitta Vritti Nirodha, controlling the chattering of your mind. Yoga practice, the practice is your Patanjali Ashtanga Yoga, the 8 limbs of the yoga, Yam, Niyam, Asan, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. And you need to practice all the 8 limbs for a therapeutic purposes.
The link పంపించింది దక్ష. So
the yoga therapy itself is yoga therapy is an adaptation. Is an adaptation of the yoga practices. So, okay. Yoga therapy is the adaptation of the practice based on your client's or patient's clinical condition. So what does it mean? We're talking about cardiovascular disorder. Say, I'm a physician, a person is coming to me who may have a heart attack. 6 weeks before, he's recovered, he's coming for yoga therapy. So how do you start? Are you going to start with the asana practice? Are you going to start sitting in a chair? How are you going to start with this patient? And it becomes your understanding of the practices, the 8 limbs of the yoga and how to use it. Or if the patient might come with a, say, pulmonary problem, asthma, COPD, pulmonary fibrosis. There you may need to learn how to first adopt some of the pranayama practice, or maybe a relaxation response. Patient comes with a bit of anxiety disorder, neuropsychiatric disorders. You may need to start with your little meditative practice. So the first of all, what you need to do is that look at a cardiovascular disorder itself. What is causing our heart disease today? From a yoga perspective, it is entirely different than from the Western medical perspective. Western medical perspective is called a reductionist. Reductionist means they're finding a cause and trying to fix it. Oh, this is due to smoking. This is due to your genetics. This is due to your high cholesterol. This is due to your diabetes. This is due to your hypertension. But you know, the Western medicine is like a tennis match. You're playing one against another. You have a pneumonia, you want to give antibiotics. You have a blockage in the heart blood vessels, you want to do angioplasty, even bypass, which I had 20 years back. I had open heart surgery myself. My book, which Lata was showing it to you, my book has all the information in the first chapter. But in yoga therapy, it's like a football match. You know, you have 10 people working together. You are planning for the cure at the root, not at the periphery level. So now, if you look at a heart disease, what is the cause of the heart disease, and what is the effect of practice of 8 limbs of yoga or practice of the Yoga Sutra of Patanjali, what it does to us? The first, if you look at the effect of yoga practice in our body and mind, as you know, it is the union between body, mind, and spirit. It is called a relaxation response. It's a relaxation response and also called activation of parasympathetic tone. These are the 2 terms you as a yoga therapist and yoga therapy teacher, practitioner, you need to understand between sympathetic and parasympathetic. Sympathetic is called fight and flight response. When I need a survival, I'm living in a jungle, an animal is coming to me, or I'm here, a car is coming towards me, what happens? My heart rate goes up, my blood pressure goes up, my respiratory rate goes high up, my muscle contracts. So either I can fight or I can flight. On the other hand, why this thing happens is due to fear. And what is the biggest fear today is the stress. The stress is the root cause for our sympathetic overdrive. On the other hand, when you create a relaxation response, you create a parasympathetic activation, which is called calm and digest. So what we learn from our learning the yoga from our scripture. Remember, we are all talking about yoga from the scripture. We're not diluting anything yoga in case of the yoga therapy. First, we find out the asana practice is your sthiram sukham asanam. You have to be stillness, you have to be happy in an asana pose. So as Lata was saying at the beginning, that you need to listen to your own body signal. So what is a body signal? The first body signal is you do not compete with anybody. This is your individual practice. You are sitting in a sukhasana or you're sitting in a chair. Doesn't matter how you want to incorporate asana at the beginning. But you start where you have a less than pain. If you create any pain, you have been causing imbalance in your physical body. That is going to hurt you. That is not going to give any therapeutic effect. So there should be no pain. And then what happens, this is called the yogic concept of Panchamaya Kosha. Annamaya Kosha to Pranamaya Kosha. Annamaya Kosha is your physical body. Pranamaya Kosha, your breath. Breath is carrier of your prana. So any imbalance you create in the physical body, it will affect your breath. So any asana practice you do, the asana practice has to be with the effortless breathing. And I'll show you what the breathing and how to do pranayama for heart disease, for cardiovascular disease. It's entirely a different concept. So the first one is that for the asana practice, there'll be no pain. But if you stay in that asana, they're called the 3 stages of asana. For the teachers, is very important. You need to know this. Even there is a Sanskrit terms. The first, when you get into asana, a simple sitting in a sukhasana, cross your feet, put your feet under your knees, and wherever. It's that your knees could be high up, stay there. It is called arambho. Arambho is the beginning. Arambho means my muscle is contracting, and let me get into that posture for asana. But if you stay in the asana for a little longer time, the muscle cannot stay contracted too long. Muscle is going to relax. Before it relaxes, it causes a little bit of called fasciculation. It's like a twitching. You will see many a time when your muscle is going to relax, and it causes a little bit of a twitching. And the twitching goes away. It is called sthiti, stillness. Arambho, sthiti. Then if you stay in the pose a little longer, it causes a profound relaxation. It is called a visarjan. The 3 stages of asana, arambho, sthiti, visarjan. So you need to be the visarjan state of a asana wherever you are. And then what happens, your brain gets a signal. What the signal, medical term, is called a neuroplasticity. If you have not heard the word, you can Google it and you can see what the word means. But basically neuroplasticity means it's a habit forming. Habit forming, like I'm doing a Paschim Namaskar, prayer pose to the back. I put my hand in the back It doesn't go any further. But here it is. I keep it here, less than pain, with my eyes closed, and I do the breathing out longer than breathing in. And I'll show you how to do this longer exhalation than inhalation. Slowly and slowly, when the neuroplasticity sets in, I can do a little bit more. I can put my hand way high up. And in stages, we call impossible become possible. Now we know the cause of our heart disease is primarily the stress. And stress creates a phenomena. This phenomena is called a metabolic syndrome. These are the very little, not a clinical term, but you have to understand this so you can do a proper therapeutic perspective. In your stress, when you have the first hormone, which is called a cortisol gets released. It creates first, it's called truncal obesity. You'll see people will have a very skinny arm, skinny leg, but there is a little bit of a bulge in the middle. It's called a truncal obesity. Truncal obesity is the root cause for our cardiovascular disorder. This truncal obesity, what happens, the fat is inside, it's inside the abdomen, it's not outside. That fat starts secreting some inflammatory molecule. And that creates a phenomena called diabetes, hypertension, heart disease, high cholesterol. So these are all together, and together they're called metabolic syndrome. So what does it mean? What it means, today I have a diabetes, tomorrow I'll have a heart disease. Today I have a heart disease, tomorrow I'll have a high blood pressure. Today I have a high cholesterol, tomorrow I'll have a heart disease. These are all interconnected. So then we started looking from the yogic perspective, what causes that fear? What causes that stress in our body and mind? What you find out that when you're looking at these patients have first and foremost has called insomnia. Insomnia means they don't sleep well. And another factor called your sleep apnea. You might have heard the term called sleep apnea, that during sleep, you wake up. So insomnia and sleep apnea is the root cause of our cardiovascular disorder, which our Western medicine does not understand that well. That's the reason the book that Lata was showing, you have seen my book. The book is called that Yoga Therapy. It's called Yoga Therapy, Ayurveda, and Western Medicine, and it's called the Healthy Convergence. And that's to understand. There's a picture of Albert Einstein and Rabindranath Tagore. We said when a scientist meets a philosopher, that's a yoga therapy. Now, from a yogic perspective, we are looking at a patient. The patient has a heart disease, patient had a heart attack, patient had a blockage in the arteries. Now his blood pressure is normal, blood sugar is normal, cholesterol is normal, everything looks okay. We don't find what's the risk factor, but when you listen to him or her, I don't sleep well at night. When I'm sleeping at night, I wake up. I feel that the sleep apnea and I cannot breathe, so I wake up. So insomnia. Now you come to the point, the root cause. If you can remove that insomnia and sleep apnea, your heart disease will get better. So sleep apnea is the root cause for our whole this metabolic syndrome. Second, what you find out that due to this sympathetic activity, that we get the tightness of our blood vessels. It's the word we use in medical terms is called a peripheral resistance. I have few physicians here, I can see in the list. Do you understand that peripheral resistance goes high up? When peripheral resistance goes up, heart cannot properly function and contract. So you need to create a relaxation response. And the primary relaxation response for cardiovascular disease is called Merudanda Achal and manasthir. What does it mean? That you always keep your spinal cord, your spine straight. If you sit in a chair, like I'm sitting in a chair, my spine is straight. I keep my spine straight. That's why I drive my car. That's why I eat my, I'm going to eat with me, use my hand or fork, whatever I use. When I'm standing up, I keep my spine straight. Why? Because I have a large number of muscles in the back, which is contracting, keeping me straight high up, and that is creating a tremendous amount of tightness and tension in my body. So for your practice for a cardiovascular disorder, you need to start relaxation. Relaxation, primarily the upper part of the body and the chest opening poses. Now, we have also called yoga therapy is called art of transformation. What is art of transformation means a person, a client or a patient came to you, he or she is called rogi. Rogi means a patient. Now you have a yoga therapist, you have to treat him or her as a patient. Very, very important concept from yoga therapy. But if he or she continues the yoga practices, slowly they will transform. We call from rogi to nirogi. Nirogi means healthy. Nirogi means no disease. And the practice changes for a nirogi. From nirogi, they become yogi and yogini. When they become yogi and yogini, the practice totally changes. So give an example for me. 20 years back, I had open heart surgery. When I had open heart surgery, when I started doing this yoga practice, I did it very, what the rogi will do. And I will start with that practice we choose right now, what the rogi will do. Then slowly and slowly, I transform into nirogi. And when I get a nirogi, what happened first? All my cardiovascular functions becomes normal. I started negotiating with my doctor. They put me on 4 medications. I said, can you cut down my medication? And slowly, all my medications were cut down. For the last 15 years, I have not touched a single medication. But I practice yoga every single day. Then I transformed into yogi. By the time I transformed into yogi, I knew that I had a daily routine, dinacharya. I had my own practice. And then what happened? I could slowly, I could see that I could do any asana. Today, if you come to my class, I do a Saturday morning at 9:30 in a Facebook Live. You can come and join me. And also I do on Fridays called a Bengali because I have a big follower in India and Bangladesh. So I do Bengali. You will see, if you can name an asana, I can do it. I can do a perfect Shishasana, headstand, a perfect Sarvangasana. Any asana I can do, a perfect Ardha Matsyendranasan, Paschimuttanasana. But I started. How did I start it? I was a rogi. How did I start it? First, I started with very gentle relaxation asanas. And how did you know relaxation asanas? We said that we learned from our babies. If you look at a baby, every baby does the asana poses. A baby will sit down in a sukhasana, sit down in a vajrasana. I don't know if you see, they'll get up into a, bhujangasana. They'll get into your adhamukha savasana. So the first, you sit down, if you sit in a chair, and if you're all want to do practice with me a little bit, I will do a very gentle practice with you, and you can see how I'm guiding to you, and you can adopt within your own practice. Okay, the first practice will be your mild, we call it a sukshma vyayam, very mild, your relaxation response. And then you will incorporate your breathing with your asana practice. How do you do it? Your lung is like a balloon. It has a 4.5 liter capacity, which is called vital capacity. And we only breathe 0.5 liter. 500 cc air is just we breathe in and out. So we'll learn first how to breathe out. And then when I breathe out, then I will start slowly breathe in completely effortlessly. I'm not going to make any effort. And I'm going to breathe out longer than breathing in. Exhalation is parasympathetic, inhalation is sympathetic. Next, my hand is connected through my mind. My breathing is connected through my mind. Breathing connects between our body and mind. How do I know my hand connects between our body and mind? When I see something nice, I put my hand like this without knowing. I want something, I do this. I'm going to do anything. I'm listening, concentrating somebody, I put this is called Hakini Mudra. We do a Hakini Mudra, we do a Dhanu Mudra, we do a Jnana Mudra. So mudras are very, very important for cardiovascular disorder. This is your Dhanu Mudra, and the mudras are very important from yoga therapy perspective. Whole universe is made of Pancha Mahabhuta. Akash, Vayu, Agni, Jal, Prithvi, space, air, fire, water, earth. So space is in the middle finger, air is in the index finger, fire is in the thumb, water is in the little finger, earth in the ring finger. So when you touch index finger and thumb, this is your Jnana Mudra or a Dhanu Mudra, and palm is up. If you put the palm down, this is called a Chin Mudra. It opens up lower part of your lung. If you close other fingers like this and hand down, this is called your Chinmay Mudra. It opens the middle part of the lung. Then if you take your hand, this is called also Balo Mushti Mudra. If you see a baby will put the thumb inside and close. This is called a Balo Mushti Mudra, called Adhi Mudra. Adhi Mudra creates a profound relaxation. So we teach the patient with cardiovascular disease that all the time, instead of closing hand like this, you always close your fist like this. Initially, thumb may be here, but with the practice, we'll do. Then we'll do it a breathing. So the way we do it, we put our hand, we put our hand in front, we'll put our hand in front, and we'll do the breathing. Like put a hand comes there, we'll say breathe out first. Slowly take a deep breath in, and during breathing out, we will do a Adhi Mudra. So breathe in, breathe out. Then with your eyes closed. Breathe. So this looks like a very simple practices, but is a profound physiological changes on a cardiovascular system. Next you do, once you incorporate the Adhi Mudra in your practice, and you'll see, if you even keep doing in an asana practice in Adhi Mudra, you already have a profound relaxation. Then slowly and slowly, when the neuroplasticity sets in, then what will happen to you? You will be doing asana practice with this without knowing, because your mind will be totally incorporating in that. Next, your mind is called the content of your five senses. What we hear is called a Shabdo, Sparsho, Roop, Rosh, Gandho. Shabdo is your hearing, Sparsho is your touch, Roop is your vision, Rosh is your taste, Gandha is your smell. The five your senses. All the input from our five senses is called our ahar. So all of you yoga teacher, you understand the fifth limb after pranayama is called pratyahar. Pratyahar. That you reach pratyahar. That's called pratyahar. That means you learn how to control your five senses. Then what happens? You have your brain has a frequency. Brain has a frequency, and you create another frequency. The two frequency interacts, and it cancels. Your mind quiets down. So what happens that your mind, which was keeping you awake and alert, which was causing your insomnia, that insomnia slowly and slowly gets better. So we teach the patient with cardiovascular disorder, sit down with your spine straight. First, you slowly start, which is called a Bhramri pranayam. See, everything you have in your toolboxes. Now you're using the toolboxes in proper sequence because the patient is sick. It's a rogi. And if you tell that patient, let's go ahead and do a sun salutation, Surya Namaskar, patient says, okay, thank you, bye, it'll be gone. So you sit down in a spine straight. You are doing a very gentle Adhi Mudra. Then you said, okay, let's do a couple of Bhramri Pranayam. So let's do Bhramri Pranayam if you're doing it here. So I will show you the one technique and we'll do together. In a Bhramri Pranayam, you put your index finger in the forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ear. And you close your mouth. So literally you see, I shut down my vision, shut down my hearing, and shut down my smell and taste. I will breathe out first. I'll take a deep breath in. I'll breathe out with the sound of a bumblebee. Let's do it 2 times so we'll get a feeling of it, how to do it. So breathe out first. Take a deep breath in. Next, you do pumping and cupping. Take both the hands, rubbing. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take both the hands, put it over the eyes like a cup, a dice, take the heat, massage your forehead, massage your eyes, your face, massage your ear, then also massage in the front of your neck here. This is what I'm going to show it to you a little bit more and more and why we do it. So a Bhramri Pranayam and pumping and cupping is a beginning of your practice. You're not going to do a Bhastrika Pranayama. You're not doing a Kapalbhati Pranayama. You're doing a very mild, gentle Anulom Vilom Pranayama because these are the patient, they're the rogi. Next thing you do, you want to relax your whole upper part of the chest and also in the neck because this is very tight. And there is an organ here which are called your carotid. The name is called carotid sinus. Carotid sinus activates your vagus nerve. Vagus nerve produces your parasympathetic tone. So there is a pranayama called Murcha Pranayama, which probably many of you may have heard the name or may not. It's called breath holding and inhalation. Abhantarin Kumbhak with Jalandhar Bandha. When you do a chin lock, see these are the things, we do the bandhas, Mula Bandh, Udyani Bandh, and a Jalandhar Bandh. In Jalandhar Bandh, you keep your spine straight and slowly will drop your chin down, touch your chin to the chest. What it does, it activates your carotid sinus. It creates a profound relaxation response. In a Murcha Pranayam, what you do, you breathe out first, take a deep breath in, and you hold your breath. When you hold your breath, your lung starts to a little bit of expand inside. When you expand, it starts then your decompression. In the decompression, it activates your vagus nerve. So let me show you. See, when you do these practices with a patient with a cardiovascular disorder, they will stay with you because they will get a relief right away. So again, my hand, I'm doing a Adhi Mudra, putting it over my knees. And if you want to do with me, let's do if you can do it with me and take a look at it first. I'll be breathing out first. I'll take a deep breath in. And I always try to do it with my eyes closed, deep breath in and hold my breath. Hold my breath very gently and slowly drop my chin down and touch my chin to the chest. And I stay here very effortlessly. If I feel any effort, 5 seconds, 10 seconds, 15 seconds, 20 seconds, doesn't matter. When you feel any effort, I let it go. It creates so much of a relaxation response. The name is called the Murcha Pranayama. Murcha means almost fainting, unconscious. So it is called your Abhantarin Kumbhak with Jalandhar Bandha. Next, what you do, you want to do physically, you want to relax your neck, which is called the Brahma Mudra. The Brahma Mudra has a 4 posture. You put your neck to the front and the back, then a side to side, on the one side, other side, you look on the back, and then turn your neck together. And let me show you one practice how to do it. The first, you want to open your chest. Opening the chest improves your, it's called the ejection fraction, cardiac function. So how to do it? It's a Paschim Namaskar. Paschim Namaskar is very nice sitting in a chair. So Namaskar Mudra, you do like this. So in a Paschim Namaskar, what you will do, you will be putting your hands okay, you can put your hands wherever it comes. If it is here, let it be here. If it is here, slowly, if your hands will come up here, close your eyes. You keep on breathing, breathing out longer than breathing in, and slowly, you will have to put your hands here. The spine will be straight, and you can see me how the Paschim Namaskar is done.
Namaskar.
So if you can able to do a Paschim Namaskar, which will be coming to you slowly and slowly, and the Paschim Namaskar, you will incorporate your Brahma Mudra with Bhramri Pranayam. So let me demonstrate to you one time and see if you can do it. You can put your hands in the back and able to stay in the posture. So able to stay in the posture, it varies. So if you can do in the middle of spine, for me, I've been doing it for a long time. I can put my hand all the way high up. I'm in a Paschim Namaskar. So I breathe out first. Slowly take a deep breath in and put my neck in the back. And breathing out, I use the sound of a bumblebee to breathe out to quiet down my mind, like this. So you breathe in, put your neck back, and breathing out, you use the bumblebee sound. Now look at that. My whole upper part of the chest is relaxed. I'm relaxing my neck. Let's do one more time. Breathe in, put your neck to the back. Breathe out, slowly put it in the front with a Bhramri Pranayam. Then you do side to side, one side, other side. Same way, you breathe out first. Take a deep breath in.
Sarkarji, just a second. You can mute all of them. You are a host now, so that we want to hear you well, because people will be texting.
Okay, so everybody's muted now. So here, from there, in the same posture, with your Paschim Namaskar, we call it prayer pose to the back, and you do look at the back without turning your shoulder. So breathing out first, take a deep breath in. And finally, rotate your neck, drop your head down from the left to the back to the right, and right to the back to the left with the same bumblebee sound, breathing sound. So drop your head down, always breathe out first in yoga practice, taking a deep breath in. So if you keep on doing a couple of times this, it gives you such a profound relaxation. So Bhramri Pranayam, Murcha Pranayam, Brahma Mudra, and your Paschim Namaskar. It is a profound effect on for cardiovascular therapy. Next, what it really affects us primarily is we call lateralization of the brain. My brain is I'm right-handed, right-footed. My left hand not be functioning at all. So use your balancing poses. Use your balancing poses, and the best way to do the balancing poses is if you can standing up. What you will do in the balancing poses, a very simple balancing poses. So it's a profound effect on your body and mind. So you'll be standing up, and then your hands, generally when you fall down, your hand falls in the ground. So your effect will be, you won't be able to see me, that's my whole body, probably maybe at the distance. Let me see. I want to show you my feet so you'll understand what I'm trying to say. These are very important from the cardiovascular standpoint. Actually, I practice on the other side. So today, because of my presentation, I was doing from here. Okay, your hand, if you can do a little bit of a Paschim Namaskar, prayer pose to the back. And I'm right-footed, right-handed. See if I can stand on my left foot. If you can stand on your non-dominant foot, 10 seconds will feel like 10 years. If you're practicing with me, you try and you'll see how difficult it is, and this is your yoga practice. 10 seconds. 20 seconds, 40 seconds. Finally, you can stand with your eyes closed. If you can do the eyes closed and stand like 1 foot, you have a total control of your whole cardiovascular system. Opposite side, to the right side. So it is not your abricussion. It is not your Virabhadrasana. As simple as it is. Initially, if you cannot do it, touch, hold on to a chair, but hold on to your ground, and then you start doing it. So the balancing poses, chest opening poses, balancing poses. Now, you may have other tools for the balancing poses. So do those balancing poses for cardiovascular disorders. Finally, you need to activate your called vagus nerve. Vagus nerve is the parasympathetic activation. So you will see that first you will be doing very simple a Bhastrika pranayama. So I'm a rogi. So this is a chair. These are called a kneeling chair. I sit on a kneeling chair that keeps your spine straight. In a Bhastrika pranayama, you will be doing an active inhalation, active exhalation. But for a rogi, patient with disease, you will be doing eyes closed. You'll be doing like this. But slowly and slowly said, when you convert into a nirogi, when you do nirogi, how do you do Bhastrika pranayama? We do Bhastrika pranayama a little bit rapidly. Then we'll be doing it like a or you can do a hand raising high up. This is another way you can do in a Bhastrika pranayama. You can do 3 speeds. You can do very slowly. And you pull it down with your Adhi Mudra. Then you can speed up a little bit. You can do a little medium speed like this. The way we explain, the first one you do is called Ishwar. Ishwar. Then you do call it so hum. Then you do a lot faster. It's called Vishnu, like this. First question I get all the time, how long I'm going to do it, what number you're going to do it, how long? It is your body. You'll be doing it completely effortlessly. What is effortlessly? You can talk, you can breathe, you can even sing. That there will be no difference between your pranayama practice and your normal breathing. See, whatever I can do now, I can do a 500 counts Bhastrika pranayama very effortlessly. What is my daily practice? 1 hour, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Kapalbhati pranayama is also very important from cardiac standpoint, but when it's done very gently. I see so many people comes to me, I'm doing a Kapalbhati pranayama, but my blood pressure is going high up. I'm doing Kapalbhati pranayama, my blood sugar is going high up. What is the reason? You do too fast. You are not coordinated enough. Remember, Kapalbhati pranayama done slowly is pranayama. If you do it very rapidly but effortlessly, it is called a kriya, shat kriya. We have a 6 cleansing from yogic standpoint: Tratak, Nasya, Dhoti, Nauli, Kapalbhati, Basti. So the way to do it, the way I do it for my cardiovascular disorder for Kapalbhati pranayama, I do it each mudras. This is called your Gyano Mudra, Dhyana Mudra. Index finger down. This is called your Vayu Mudra, controls your vata. This is called your Shunya Mudra. It helps in your hearing. This is called a Prithvi Mudra, touching your ring finger and thumb. This is called a Varun Mudra. It helps in your bladder function. This is called a Shakti Mudra. Ring finger, little finger, and thumb. Shakti Mudra, Prana Mudra. This is called your Apna Mudra. Middle finger, ring finger, and thumb. When you bring your index finger down, this is called Apna Vayu Mudra. This is for your heart. I have all of them in my YouTube. If you can go to my YouTube channel called Dilip Sarkar Yoga, or in my book has all of this. My book inside, there is about 250 pictures, and all the pictures, as Lata was showing it to you, with every mudras, every asanas, all the colored pictures, all our mind is all here. So when you do the Kapalbhati Pranayama, you do with a mudra, start Dhyana Mudra, close your eyes, keep your spine straight, and we'll be doing it. One per second, your awareness in your belly button is pushing back. Okay. You noticed I have no connection with my breathing. I did not do any breathing. I did a exhalation, and the breathing was, inhalation was in between without any effort. That is your functional Kapalbhati Pranayam for cardiovascular disorder. What it does, if you look at your abdomen, your belly button goes to the back, it hits your diaphragm, and here is a lung and the heart, it massages your heart. So if you're new to the practice, if you put your hand in the belly button and a hand under the nose, if you push your belly button back, see all the air is coming out. So if you look at somebody has a heart problem, even somebody's heart stops, what do? You call it CPR. You push heart from outside, called cardiopulmonary resuscitation. Massage your heart. Literally massaging from inside. This internal PR, but very gently. You do slowly became nirogi. You do the chest opening pose. Best chest opening poses are bench mat. So you have them head down, so you can get into your Bhujangasana. Powerful chest opening pose. Or in the mat laying down, you get into Setubandha Sarvanga Asana, bridge pose. Or you get into Matsasana. Always remember that any chest opening poses, or you can get your Ustrasana. Those are very good for your cardiovascular disorder. And finally, the most important pranayama, which you will be needing for cardiovascular disorder, is your alternate nostril breathing, Anulom Vilom Pranayam. And then I will guide you slowly and slowly what it does for your asana, pranayama, and meditation. And in the meditation, let's remember, the meditation is not closing your eyes, following your breath, paying attention to it. Meditation is that staying calm in the middle of crisis. So why do you have a heart attack? I'm playing tennis. I get a ruptured plaque. I get a heart attack, acute heart condition. Or I'm emotionally upset. I've been in argument with my boss or my spouse or my children. I got a chest pain. I got a heart attack. So a meditative state. And the meditative state is your state of your mind, keeping the mind. See, normally I'm generating thought process. I'm generating thought process, 30 to 40 thought process a minute, 30, 40,000 thought process in a day. But remember, majority of my thought process is in the past. Majority is in the future. Very few in my present. Living in present is a meditation. In living in present also, a large number, 95, 90% is a thought process. Yeah, at 5 o'clock, I have to click Zoom, I have to talk to completely chat in my mind. In meditation, you enter between the thought process, called a gap. Slowly and slowly, you widen the gap. When you widen the gap, you still have the thought process, but there is no repeat thought process. That's Yoga Sutra. Chitta Vritti Nirodha. Chattering of the mind goes away. And that goes away when you are able to access your Sukha Sharir. We have a Sthula Sharir. Remember, our body, mind, and spirit. So most of you are in the computer field now in the Houston. You are in the computer field. Think about a computer. My body is a hardware, mind is a software, spirit is a programmer. Who is the programmer? I am the programmer. I'm programming software, program my mind to control hardware. So how do you practice? Finish with that. How you control your mind, control your software. It looks like almost possible, but you will be able to do it. When you do a Anuvilom Pranayam, 100 knot breathing, build the Anuvilom Pranayam with a Vinu Mudra, which will be focused on Anuvilom Pranayam. Then we'll Anulom Pranayam with a balancing, which is called Super Brain Yoga. Then we'll do Anulom Vilom Pranayam without closing your nostril. That's your meditative Anulom Vilom Pranayam. So what happens here, when my body and mind is united in yoga, I have a Sthula Sharir, then I have a Sukha Sharir. Sukha Sharir is when I close my eyes, I can see my body. I can see my body is here. I can even see I'm here in Norfolk. My body is in the Houston. I did a lot of program in Houston. I did a program in Woodland. I'm in the Woodland, or I'm in Arya Samaj. Here it is. I'm entering into the main entrance door. I can clearly see myself. Or, by eyes closed, I can touch tip of my nose, I can touch my left middle finger. So clearly I can access with my eyes closed. That is a state of meditation. That will be able to do it when we're cardiovascular disease. In a left hand, first, you do a mudra. This is your Dhyana mudra or Ano mudra, wonderful mudra, and do it, put it on a knee. Right hand, close your nostril. You don't have to close all sitting down, just underneath nostril, which is good enough. First, you breathe out through your breathe out left nostril. And slow breathe in through your nostril. Put your hands down, use your left nostril with a finger, and breathe through your right nostril. And breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. And if you're doing with me, you keep doing it, and I will tell you the benefit of this and how it affects your cardiovascular system. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Left nostril breathing is called Chandranari. Cooling energy. Ida Nari. Right nostril is controlled by the left brain. Left brain is analytical. Left brain is heating. Left brain is age. Nostril thing is called samadhi, which is hitting. Once you do a little bit of alternate nostril breathing, how much? Completely endless. Then slowly bring your index finger and middle finger, put it in your third eye, between your eyebrows. And then for clear eyes, bring awareness to your third eye. Now, alternate nostril breathe. Not to left nostril. Without your nostril. Keep doing alternate nostril breathing. Just focus in your thigh. Slowly and slowly you're entering into meditation. Don't do meditation. You prepare your body, mind, and breath so that you enter into a state of meditation. Next, you do this another fascinating technique. You take your left hand, you hold it to your right earlobe. This is called super brain yoga. This brings your balance back. I don't know if you've seen super brain. In super brain, you hold, cross your hand, hold the both earlobe, then you go sit up and down. You know, we used to give a punishment when you're in the school back in India, and this is called a bringing the balance. So your Vishnu Mudra or your index finger and middle finger in the third eye, left hand is holding your right earlobe, and you are doing Anupilum Prat. Cardiovascular disease is going to run away from cardiovascular disease. Will say the body need to continue as long as can, and then also remember that that's samatha. Yoga is balance. Health is balance of the mind and body. So now we're doing with the opposite hand. With the right hand you're holding, the left earlobe, the left hand putting it in finger, and we're doing alternate nostril breathing. Opposite side. The important yogic concept. Always bring balance back. What you do on one side, you always want to do on the other side. There's lots of other techniques for cardiovascular. Let me finish. I know there is a, when I talk, the clock just runs. You know, Latha, let's be 5-10 more minutes. I'll finish it. The next practice, it is all the practice you do together, but it is an interesting practice. Interest practice is you do Ujjayi Pranayam. Ujjayi Pranayam, remember, it is you try to constrict your vocal cord, but if you do it very slowly and gently, we relax it. What it does, it stimulates the branches of called vagus nerve. It's called superior pharyngeal nerve. And slowly you breathe in, get a profound level of relaxation and activation of parasympathetic. With that, you incorporate Jalandhar. When you do Jalandhar chin lock, you activate your rotator surface, which is also a profound relaxation rest. Then end with Chandra Pranayam, nose breathing, which is a cooling your day and mind. So let me show you this pranayama. There's very little bit of a sick combination for cardiovascular disorder. Then we'll finish with meditative alternate nostril breathing. That will do alternate nostril breathing without closing our nostril. So again, with the way I do it with my Adhi Mudra. Adhi Mudra really puts a profound relaxation. I do it with my eyes closed, with my spine straight. I breathe out first. A deep breath in. Completely breathe out. Profound practice. Ujjayi pranayama, Jalandhar bandha with Chandravriti pranayama. And these are the things that cardiovascular people, cardiovascular disease will be able to do it. Also, we do, short of time, maybe come to my class one day, I do it most of the time. We do a Surya Namaskar, sun salutation, sitting in a chair. We do all the 12 asanas sitting in a chair, and for cardiovascular disease. Now we'll finish with called meditative alternate nostril breathing. Always remember, we breathe through our nose. We do not breathe through our mouth in your practice. Why? When you breathe the nostril, nose like yours, you fill it fresh air. Nose the personal condition. If outside is warm, it will cool down. If outside is cool, it will warm it. Then goes inside of nostril, turbine, and the air goes into your lungs, which is the channel, your lung. So all the air you through your nostril goes into your lung. But if you breathe through your mouth, you don't know where the air has gone, whether gone down into the stomach. We do the mouth breathing. It's called Shitali Pranayam, Sipi Pranayam. We do your tongue out and do it. But that's for different reason. That's called a cooling effect. That is not for your effect of your pranayam. So somebody always asks me, I have to breathe through my mouth. Then what you can do, you can breathe through your nostril and breathe out through your mouth. That is more functional, more physiological. Touch your index finger and thumb, Dhyana Mudra, Jnana Mudra. Put it over your knees. Close your eyes and bring your awareness in your left nostril. And this is what, in silence. When you are in silence, what happens? That we always like to do little meditative practice in silence. In silence, all the senses quiet down. And when you keep your eyes closed, vision is the most important input between five senses. That takes place when you close your eyes. Close your eyes, you are silent, your awareness will be in your breath without closing your nostril. I'm guiding you. You will breathe out through your left nostril first, without closing nostril. You will breathe in through your left nostril. That is out right nostril. You'll breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing in through my left nostril. I'm breathing out through my right nostril. Just close your eyes, keep your neck relaxed, and continue alternate nostril breathing without closing your nostril. Give it a try. You'll be amazed how easy it is to do in a meditative practice. I'll give you a signal in a couple of minutes, and we'll finish at that time. slowly bring your hand in front of your heart chakra, Anahata chakra. Touch your little finger and thumb. Separate your finger, middle finger, index finger. This is Padma Mudra. Padma Mudra connects your body, mind, and spirit. Your soul, heart is out of your soul. Slowly your Padma Mudra close to your heart. Use the word all the time. Memorize by heart. Heart and mind is connected. The practice of yoga therapy gives us wellness. Wellness is physical wellness, mental wellness, spiritual wellness. Physical wellness of strength and stamina, mental and spiritual wellness gives healing. Slowly bring your hands again, put in together in a prayer pose. The eyes are still closed. You are in front of your Anahata chakra, heart chakra. Slowly bow your head down, and the word is Namaste. I honor the divinity within you. And finally, a wonderful yogic practice which will continue throughout the whole day is pumping and cupping. And again, rub your hands, rub your hands. This is a rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Put your hands in the eyes like a cup. Let the eyes take all the heat from your hand. Then massage your forehead slowly. Massage your eyes. Massage your face. Massage your ears. You know, in front of the ear, in the back of the ear, there is a nerve called auricular branch of the vagus nerve. It feels relaxation and massage your carotid sinus, is called, and massage your back, and a wonderful outcome. This is a practice, really it doesn't take, when you do it without talk, it will take about half an hour, maybe even we'll learn that. But we do about an hour practice. I don't miss a single day. Doesn't matter where I am. I'm in the plane, I'm in the train, I'm wherever I'm always doing practice. And let me see, we have a lot of messages here. Please mute. Can you mute? Thank you very much. Organizing the Dr. Sarkar, we are thankful for you. All our family are very much. Again, Dr. Sarkar, always here. No attention. All my friends here. I see all my Houston connections here. I've been Houston maybe what? I don't know, maybe 10 times, I just talked with Shekhar. He's going to Boulder, so he said he could not join. Okay, you can unmute. If you have any questions, I still have 3 minutes. The questions I'll be glad to answer. Or if you have any comments, I want to hear your comments. And if I have not explained anything to you, I'll be glad to explain. But see, that is the same practice you do. I have not done any different practice. But what I did, pick and choose for Rogi, Nirogi, and Yogi.
So, Dr. Sarkar,
yes, sir.
Do you have Dr. Pachipala? I think we met before when you came to Houston.
Mm-hmm.
But do you have any specific yoga technique for rhythm problems, cardiac rhythm problems?
Yes. And let me out of the see. How do I get off my spotted view? Cancel spotted view. Let me get into the. Okay, now I see everybody. Okay. Cardiac rhythm problem. The first cardiac rhythm problem is called the atrial fibrillation. It is a very common cardiac rhythm problem. And what you find out in the cardiac atrial fibrillation, it is purely a sympathetic overdrive. And I have a very interesting story to tell you. There's a patient who has a atrial fibrillation, and the cardiologists do, I don't know if you heard, they call the cardiac ablation. They do a cardiac catheterization, and they correct the cardiac rhythm problem. In a hospital, it's hard to schedule. She was scheduled 3 weeks down there. and called me. She said, I had atrial fibrillation. So I told her that you need to have a relaxed response. See, interesting. I was going to show it to you. I've been to you so. I have a saline in my mouth. What the saline in my mouth says, I have a parasympathetic activation. When you are fearful, when you become, say, afraid, what are you going to get? Dry mouth. Dry mouth is sympathetic. And wet mouth is parasympathetic. I didn't drink any water, nothing. I've been talking all this time. So the primary component of your activation of parasympathetic tone is a relaxation of the upper part of the body. Primarily, Paschim Namaskar, or especially what I showed you, Mudra with Pranayam, there is Hamritayam, Japranayam, and Ulom Pranayam. So you keep a few, it's the practice you to do it, but to keep the concept. Concept of Tardidam is creating relaxation response both in body and mind. Any? Did I answer your question, or you have more? You want to know the protocol? I want to do this. That is a problem with the Western mind, But what happened for us when you keep on doing it ourselves slowly and slowly, and it is called your experiential. And slowly you can see. Generally, I don't know if I have shown it to you. We practice with our Apple Watch. So we get all the monitors, we get all the cardiac monitors. I have EKG, I get an EKG, heart rate, cardiac rhythm, all during my practice. And we know slowly and slowly how to take care of it. So activation of parasympathetic tone, active relaxation response for cardiac rhythm. Else. Have you done with it? So talk if you would like to. Yes,
So,
question?
Yeah, I see one more question here. How many minutes I can spend on each of these asanas? That is.
See, remember what you said, that it is not your timing wise competing with anybody. It is your love, comfort. You are doing no pain, sitting in asana. And always, when you're doing for a therapeutic asana, that every asana should be like your sabasana. Every asana is sabasana. Every asana with a effortless breathing. I'm sitting, I'm doing a Shirsasana. In Shirsasana, my breathing is completely effortless. I can talk, I can breathe. How did it happen? It happened in stages. There's a beautiful word in yoga therapy called in stages, impossible become possible. So don't look at the timing wise. Don't look at any, those are great when we are young, when we want to do jump up and down, want to, have a strength from yoga practice. This is therapy. Remember, it's yoga therapy, and it is customized, individualized. So effortless breathing, a pain-free asana, and stays heading into meditation is therapy. It could be 10 seconds you at the beginning, but down the line, 2 months, 6 months line, it could be 30 seconds, a minute, be 2 minutes. And I all the time, although it's my class, I'm taking class long here for 20 years, and somebody will come and says, I'm doing less asanas now. And I said, why are you doing less asanas? Well, I don't know when I'm doing it. And now I can realize staying in one asana for a longer time than do it. Happened for all of us. Could not even stand on left for 10 seconds. 1 minute, 10 minutes, I can do. Just not the food. Don't pay attention to your time. Pay attention to your body and mind.
So I don't see any more questions. We will, if you guys have any questions, please do write or talk. Otherwise,
or just call me, email it to me. You can go to my website, dilipsarkar.com. All the informations are there.
Anything kids, any suggestions for kids to make them more calm and focused on studies with all this now homeschooling we are happening? You know, any advice would be great.
Beautiful question. We do it all the time. I teach kids from 4 to 8 years, 4 to 12 years. Not a single kid can do any yoga. So cannot do any balancing poses. They cannot do any breathing techniques, any parameters. The reason is not even for COVID. This is their mobile phone. This is their mind. Chanchala. Mind is so chanchal, they cannot even stand one. Forget about all shiksha. I used to think as a kid, able to Dishasana, Sarvanga, do anything smart. We find now with the children, the children at a certain age, so I say generally between 5 to 10 days, can do yoga practice at all. But they can follow their parents. So what you say them for the parents, why don't you do it with the children with you? What we find it out then, very simply, we start teaching them a little bit of a pranayama first, a little bit of a Bhastrika pranayama. When they keep on doing Bhastrika pranayama, it is a wonderful practice for the kids. Kids don't do it on his own. When the father is doing it, Bhastrika raising or doing it, kids will do it. Especially, we have done this research and work with the autistic kids, amazing autistic kids that follow their parents. So my request to you will be, the children are not going to do yoga on their own. So you do it and you have them with you. Also, they're becoming very restless. Let them sound in the ground or chair, wherever they sit down. Start with a little bit best pranayama. And then we'll all Vilom pranayama. Begin with the pranayama with kids. I've done a very rapid burst of pranayama by Savasana. And the old mother comes and tells me, what did you do to my kid? I said, what? But they've never done it before, anytime at home. I said, there is a beauty of power of breath for your physical body.
And
this is the most hardest time in our life, what we are going through now, COVID-19. Yeah, somebody has another question?
one last
comments?
Yeah, Sarkarji, is there any connection between spirituality and heart's health?
Yes, definitely. So remember one thing, spirituality, what you talk about spirituality means that believing in a power above me and surrendering. And most of the thing what the spirit, the word is called soul. Soul is called your inside, call it your introspection. What is introspection is that self-discipline, self-discovery, self-realization. Those words, self-realization, the spiritual practice, self-realization. Self-realizations that my eyes are now backwards, looking inside self. What I found, I have a doctor in me, and my doctor is in me that I am the cause and the cure. It is a powerful spiritual experience. And when you have experience, you correct and cure your heart disease from the root. See, when you do a physical wellness, what you do in the Western medicine, you are just taking care of called Annamaya Kosha. But remember, heart disease is a Manomaya Kosha. It's in the mind. It's in Vijnanamaya Kosha. It is Anandamaya Kosha. So spiritual health is your Anandamaya Kosha. So that's what I said at the end. We have a physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental, spiritual wellness gives us healing. Wonderful question. Thanks for asking.
Thank you, Dr. Sarkar ji, and for very informative and educational program. I'm honored. As soon as I called you, you accepted. Not, everyone has heart, but not everyone, have kindness in it. So you have it, and your compassionate and kindful heart, brought us here and educated everyone. We are thankful for that one. And I hope to see you once again in person, because I missed when you came here. And I encourage every participant to go to, his YouTube channel. He has so many therapy sessions there. I encourage everyone to practice and, improve your health and protect your $1 million body. That is my
My last statement before we finish is that I don't teach. I share my practice with you, and you as a teacher, my request to all of you, please practice. Please practice. Please practice. You'll be a wonderful teacher. All the doctor comes to me. He said, hey, I want to incorporate yoga therapy in my practice. I'm a family physician. I'm internist. I said, very simple. What is that? You start doing it. You keep doing it. You start feeling yourself. You'll be able to eat. And the last word to finish for all of you. Karo yog, raho. Do yoga, stay healthy this week. Thank you.
Thank you all for coming. We will see you next time. Bye bye.
Thank you.